And welcome back. My final guest is Julian Palmer, the new Executive Director of Touch, a local not-for-profit here in Clarkstown. Welcome, Julian.
Thank you, George. It's a pleasure to be here.
So, Julian, you have a very interesting and diverse background and a lot of experience in the not-for-profit sector. You're taking over, took over last year, late last year, from Rob Maher, Rob Maher had been a longtime director of Touch and really I think put that agency kind of where it is today. And you've taken over for Rob and you're bringing it to a whole different level and bringing it forward. Before we get to Touch, for the benefit of our viewers, let's hear a little bit about your background. Maybe you could talk to us a little bit about your background and your experience and what brought you to Touch.
Sure. Yeah. First, thanks for the opportunity to be with you and have this discussion. I have always really wanted to make a difference in the world. I'm one of these people. I believed all these, high school, college graduation speeches, like go out and make a difference. You can change the world. And I took that seriously, and I've been fortunate to have a lot of opportunities where I could work with great people towards that goal. I used to be executive director of New York State Common Cause, a government reform group that works for open, honest, and accountable government. I was with Common Cause for about 7 years. I went back and got my master's of public administration to further my work in that making a difference. And then I came to, around the time I became a dad, I became very interested in children's issues, and I got a job as the communications director for the National Center for Children in Poverty at the Columbia University School of Public Health, and really saw the effects that poverty have on children and healthy child development in communities, and worked there for 6 years. We did a lot of reports on the impacts of child poverty and how to prevent poverty. And then during that time, I moved to Rockland County, 1997. We raised our family here, two wonderful young daughters, and did consulting work with a lot of nonprofits in the county, building on my experience with Common Cause and the Center for Children in Poverty. And also during that time, I came to know about Touch and Rob Maher, my predecessor, as director. And when Rob retired last year, and I heard about the opportunity to become director of this wonderful organization, I was happy to apply and grateful to get the opportunity to take on the challenge of building on Rob's great work and the work of so many people who've built up Touch's achievements. And as you said, we're working hard every day to take it to the next level.
Right. And folks that are familiar with the show will remember Rob. I mean, we've had him on a couple of times, and he really shined and beamed when he talked about his work at Touch. So big shoes to fill, but you're more than capable, for the task. Maybe you could explain what Touch is. It's what the word touch means. And let's kind of break it down and talk a little bit about some of the things Touch does within our community.
Sure, yeah, happy to do that. Oh, first of all, you mentioned the big shoes to fill. Yeah. I think Rob and I both have size 13 shoes. We're both tall guys, big guys. So hopefully I'm up to the task.
You absolutely are. You absolutely are.
But as far as Touch, Touch stands for Together Our Unity Can Heal, which is a beautiful concept to me, and just the name appeals to me. Especially these days, there's so much, partisan differences and debate. People want to argue about everything, and just the idea that we all should be able to work together for basic things like preventing hunger in our community, and helping people with chronic illness, and making sure families have the basic supports they need to have successful and productive lives, and stronger individuals and families make stronger communities and ultimately make things better for Clarkstown and Rockland and all of us. So that concept of unity for working together for public service is very important. Touch's history, I think you alluded to. We started out as a Ryan White Act group providing services to people with HIV, and this was at the height of the AIDS crisis. And we did a lot of work with case management and nutrition programs to help people with HIV. And we've helped make a lot of progress against that once really deadly disease. We've been part of that. I'm proud to be part of that. over time, what we've learned in helping people with HIV, we've learned can help people with other types of chronic illness, obesity, heart disease, Hep C, diabetes, a lot of chronic illnesses. So we've come up with a program that works, in helping people manage their medication, their nutrition, and getting support. We have support groups and nutrition classes at Touch. So all these things really help give people the support they need to manage their chronic illness. And some of our members have been with us, for decades, and they really feel like Touch is their family. And the people who work for us and the volunteers, they become like family with the people we serve, and it's a beautiful thing to watch. We have a wonderful, diverse community of people who come through the office every day. And also we do a lot of work around hunger prevention and nutrition. As part of that, we have a food pantry at Touch. We distribute about 500,000 pounds of food a year to people in need. And we have a registered dietitian who works with them to make sure, not just that we're meeting their hunger, preventing hunger, but also getting them food that fits their particular health circumstances and helps them manage illness or prevent illness. So that's very important to us.
So talk to me just a little bit about the food pantry program.
Right.
I'm familiar with Touch, and I think I've talked about this before on this program and with other guests as well. But I spent 21 years in the not-for-profit sector as well, and during that time, one of the last places I was at was Bridges. Now it was formerly RALC, and we started up a food pantry program there to work with folks within Rockland County. Can you speak to a little bit about the food pantry and really the need here in Rockland? I think people are really under a lot of have some illusions, that we live in a wealthy community and there's really not poverty here, and there really is. And maybe you could speak to that and how your food pantry program, because I think you guys have a great pantry program, how that really is kind of addressing some of the need.
Right. Yeah. Thanks for that question. Rockland, it's close to 25% of the children in Rockland County are growing up in poverty, which is a very high number, really a shocking number. And overall, there's roughly 1 in 7 people are in poverty, and with that typically comes food insecurity and people not necessarily being able to have 3 meals a day, and going to bed hungry at night, and that affects your whole life. So it's very important to take that seriously and to address it in a meaningful way. So our food pantry, we are proud to be meeting that need, and we do it with help from several other groups too. We're a big believer in collaboration. We work with the Rockland Community Against Hunger. We're the lead agency for Rockland Community Against Hunger. And we partner with Bridges and Meals on Wheels and a lot of the other great nonprofits in the county. Martin Luther King Center. It's dangerous if I start mentioning some, I'm going to forget somebody. I just want to give a blanket thank you to all the partners who work with Touch and Rockland Community Against Hunger to meet that need. In our pantry, we have a wonderful food program nutrition director, Paula Klein. We got a great staff there, and they meet with people who come in. First of all, we have emergency food available for anybody who needs emergency food. They can come to Touch. I can give out the number later, I guess, or
no, go ahead.
It's
now
845-268-8023. And if you call there, if someone is hungry, their kids are hungry, they need emergency food, we'll provide them food, on the spot. And then if they need to come back, if it's a recurring thing, we see if they can be enrolled in our food program and work with our nutritionist. So that meeting that emergency hunger need is a key thing that our pantry does. And then we also have a lot of people who are enrolled in our food and nutrition program who work with our dietitian, and they look at their specific health conditions, if it's diabetes or heart disease, and help them create a diet that will meet their health needs and help them manage their illness. And we also have nutrition education groups many other programs that are tied to the food pantry.
So how, as we kind of talk about that, so the medical nutrition therapy, so you're really kind of targeting a very unique space within the not-for-profit and the healthcare sector. It's really folks that are suffering from, not just HIV, but now chronic illness. What are some of the things that people that are facing chronic illness are facing, in terms of trying to maintain a healthy lifestyle, and how are you trying to address that?
Right. I mean, chronic, heart disease or obesity, things like this can really limit people's ability, in some cases, to get around. Sometimes they're homebound, and we do have a home meal delivery program too, for that. And then we also have worked with the dietitian to see that that not just delivering food to them, but food tailored to their specific dietary needs.
Right.
So that's we look at each person individually and look at their individual needs and how the illness may be affecting them. Could be affecting. Mobility is one thing. Sometimes it's ability to work, which also, if they can't work, that can put pressure on their income. So if we can help them manage the illness well enough where they can continue to work, that's a plus for the community. In some cases, it's where their lifeline too, just getting food to them that they wouldn't otherwise be able to get.
And you also work with caregivers, as well, because that's one of the issues that folks are facing. They put together a framework of support, a support network or a support system, and caregivers quite often can really be in a situation where they become burnt out or they need additional supports. How are you trying to address that need with the folks that you're working with, with the people that are rendering care to them?
Well, we have an excellent case management program led by Dio Dominguez, and that program, we help manage and coordinate services for people so that the burden isn't, whenever possible, get multiple service providers and healthcare providers to work together. We have case conferences with the clients and try to coordinate services and make sure that the burden of care is distributed, and so that it's manageable for the providers as well as the receivers of the care.
No, absolutely. So let's pivot to how people can help Touch. So you have volunteer opportunities, I would imagine, and you also are looking for money, like every not-for-profit executive director. So maybe you could talk a little bit, as we're coming towards the end of the interview, about how people can get involved, how they can volunteer, and how they can support the work of Touch.
Sure. Yeah. Thanks for that question. It's a key question. Ultimately, for nonprofits like Touch to succeed, we need people to support us and care about our work and be involved in it. So we have volunteer drivers who deliver the meals to people at their homes. So there's a need for that, especially in the afternoons. By the way, we have a good group of volunteers that come in, and we work with the ARC and Juanio and local groups that provide us with volunteers. Help pack up food and work on the delivery of food but they're typically in the mornings, and we need drivers in the afternoon. So we could have, if people want, again, that number 268-8023, if they would like to drive and deliver food.
So how many, just roughly, how many volunteer slots do you think you typically need to kind of help supplement? You deliver a lot of meals, right? Hundreds of meals?
Yeah. We definitely can use more. I keep calling, and we'll tell you when we got enough.
Yeah, great. All right.
So that's one way. We also are getting help with food recovery. We're reaching out to supermarkets or other places that have food that would otherwise, food that's good and fresh, but otherwise would go to waste, to donate food to Touch, and we will distribute it through our network. There are dozens of local food pantries that we work with. So we're looking for food donors and then volunteers to help deliver the food to food pantries And we also have our Get Fresh monthly food distributions.
Right.
These big 18-wheeler trucks come down with food from the Northeast Regional Food Bank in Latham, New York,
Right.
near Albany, and we need people to help, unload the food from the truck. We do need money and, financial support, of course. All the, these things all cost money.
Yeah.
So donations are always appreciated, and you can go to touchny.org, touchny.org, to make a donation through our website, or learn more about our programs. So that's another way that people can help.
And do you have any annual events or upcoming events? I mean, this interview will this segment and this show will run going into the early part of the summers. And of course we do repeat these sometimes. So
Right.
So if you have any annual events that you're aware of or fundraising opportunities, you could mention those now as well.
Sure. Well, we're actually, we haven't finalized the plans yet, but next year will be our 30th anniversary, so we'll be looking forward to a 30th anniversary event for Touch
Oh, great.
in the not too distant future, and we'd love to come back sometime
Oh,
or
absolutely.
talk more about it.
Absolutely, we'll have you back
Yeah.
before that.
Great, thank you. And one other thing too I should mention is for farmers markets or some of these local gardening programs too, if people would like to donate fresh produce to Touch too. There's a lot of the donated food we get. There's a lot of bread and bagels and pastries and things like that, which are appreciated. But with our Get Fresh program and other ways, we're always looking for more fresh produce to get to people, because that's a key part of a healthy diet and healthy living. So
Right.
if there are any local farmers markets or local gardening programs, local gardeners who'd like to donate, please give us a call again, 268-8023. And we'll arrange a pickup or delivery, and we'll get that to people who need it, and we'll benefit from it.
Well, Julian, we're just about out of time, but I do want to thank you. I want to thank you for being such a wonderful guest, but I want to thank you for your leadership and your leadership in the not-for-profit sector, because you're at Touch now for still in your first year, but you've worked with a lot of other organizations. I know. Throughout my time in the not-for-profit sector, I would come across you in a number of different capacities that you worked in, and that's a unique calling, and that's a unique way in which people can really give service back to the larger community, and you're really to be commended for it, and your dedicated and authentic leadership within the not-for-profit sector. Having spent 21 years there, I very much appreciate the job of the not-for-profits. I don't think that their job that they do in our community is always understood or, frankly, respected or heralded the way that it should be. And certainly Touch is just another one of those wonderful organizations that we know you're going to bring to the next level. I want to thank you for that.
Well, thank you. Yeah, I'd like to say, I know you've done work with Rockland Independent Living Center, as you mentioned, and you know the nonprofit world firsthand. So I appreciate that, what you've done, and your support for the nonprofit community. And I just would want to emphasize, sometimes people think, oh, we can't afford to support nonprofits, but the value that they bring back to Clarkstown and Rockland is, many times over. For every dollar invested in nonprofits, we bring back services, federal, state contracts. And we make a real difference in the quality of life in our community, and it's great to be a part of that community and work with public officials and other nonprofits and the great people at Touch to make that happen.
Well, thank you so much. And just give your contact info one more time, phone number and website, if people want to be able to volunteer. And we would encourage as many folks that are watching this, please volunteer or open up your wallet and try and help the good folks at Touch. But your contact info again?
Sure, thank you. It's 845-268-8023, 268-8023. And our website is www.touchny.org.
Great.
We'd love to hear from you.
Absolutely, and we'd love for you. We'd love for everybody watching this to make sure they pick up that phone and call or reach out and see how they might be able to support Touch and the other good not-for-profits in our community. Well, Julian, thank you so much. We'll be right back. Please stay tuned.